You're tuned into the Advo Health Podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real. Hello everyone, welcome back to the ASH Podcast. I'm Omar, joined by my co-host Ali. Today we're diving into another episode of the Rare Tapes. It's been a while since we did one of those. This is our series where we bring real-world healthcare moments to life through short, immersive stories.
Firstly, welcome back, Omar. If anyone saw our last episode,
thanks.
He was missing.
Yep.
But, that happens from time to time. So, there might be an episode without me because I might be busy. But getting back to this, these are the quiet moments that don't always make the headlines, but shape how people experience care. The tension, the waiting, the small breakdowns in communication that change how patients feel about the system. So let's get into our first story. Scenario 1. The family interpreter. You're sitting in a small exam room with your grandmother. She doesn't speak English well, and the doctor just walked in. You're nervous, not for yourself, but because you're her translator. So when did the symptoms start? You glance at your grandmother. She looks at you, waiting. You translate as best you can. The doctor keeps talking fast. Words like dosage, side effects, follow-up. You try to keep up, but you're not sure if you're getting it all right. Your grandmother asks you in her native tongue, "Everything's okay?" You nod, even though you're not sure. When you leave, she smiles at you gratefully. But you can't shake the feeling that something might have been lost in translation.
Okay, so I think that is the end of the scenario. And honestly, just first thoughts at it, I think this happens all the time. Family members sometimes have to step in as interpreters, and it's actually really interesting because I did learn this in class 2 weeks ago about interpreters in family med clinics and stuff. And usually they have an interpreter on site that actually knows the medical terminology, and those are the first go-to things. They would bring that into the room. But I know that in some places, clinics where you're understaffed or you just don't have that resource, you're gonna have to depend on a family member to be that point of contact, that middle person. But there's always that risk, and that's kind of what we see in this scenario. Some things can be lost in translation, and it's really hard to make sure that what's being communicated is as medically accurate as possible for your family member, but also for the doctor. The conversations are two-way, so there could be gaps on both sides.
Yeah, for sure. I think easily you can miss details. I mean, in the scenario where they're talking about words like dosage, somewhat not exactly medical jargon, but it can be kind of. I feel like dosage side effects are still commonly used words, but you have more complex issues. You have more medical jargon in there. There's not always a direct translation for stuff, which then makes it confusing because someone on one end, the doctor's asking you questions. On the other end, you're trying to translate it, but you're also trying to figure out the right word so that it's not confusing, and then do the same thing back. A lot of things can get miscommunicated or misunderstood. And I think this is not just also in the medical setting. Anytime you're trying to translate for someone, there is going to be a little curve to it. You can't just instantly translate every word that is being said.
Yeah.
Because the meaning changes, right? Even a direct translation of words won't help, which I think if anyone's really used Google Translate often, we can see this where you put in a phrase and you're like, okay. And then in grammatically, the sentence makes no sense because what it's done is translate every word for one-to-one. And you're just that means something else entirely. Or then you find out in the dialect or in a specific language, then things mean something else, or there's different words for it. So
Mm-hmm.
that becomes an issue. And I mean, for the translator, like you said, it's not an easy feeling. It's
Mm-hmm.
pressure. You're giving sensitive information. There's an emotional weight to it. And
Mm-hmm.
I want to ask you if you guys have studied this. Like, I don't know how much in the topic you've dove into, but is there also like an ethical dilemma of it? Like, is it breaking doctor-patient confidentiality, or like, I don't know, could that be a case?
Yeah, I mean, there's a lot of points to it. I mean, the first thing is that when there is a family who's coming in and there is like an interpreter, for the doctor, the most important thing is that the communication is happening directly to the patient. So even if there's an interpreter, like a family member there, like for example, like let's just forget that we're even talking about interpretation. If you have a family who's answering the doctor's questions and the patient is not doing it, the doctor is going to like say that like I appreciate you like translating and whatever the reason or context may be, but I need to speak to the patient directly. So that's why you have to keep eye contact with the patient regardless of what the interpreter is. You respect their presence, but you have to be talking to them. And also, yeah, with regards to ethical issues, you don't know the context behind what their concern is. Like what if the patient is coming for something like related to their sexual history, right? And in that case, maybe they don't want to tell the family member about it, like they want to keep it
Yeah.
confidential. So then if the family member is the interpreter, they are indirectly finding out that information. So in certain situations you have to maintain confidentiality, and sometimes if especially if the patient is of age and they have the right to keep their information confidential, then you have that concern. Yeah, and on top of the language barriers and everything, there's just the information, the content itself that's coming into the clinic. Sometimes it's only meant for the patient and doctor, and the family members is only going to receive it if the patient gives consent for that. So when there's the communication barrier, you have to find another interpreter. Like those cases are tough is what I'm trying to say. Yeah.
Yeah. So there's like an ethical gray area almost of like,
Absolutely. Absolutely. Yeah.
if you don't have a professional interpreter on staff, then definitely it's a mix of what do you prioritize, actually communicating to your patient,
Mhm.
or things that they may not want their family member to know. I
Yeah.
think for sure.
Yeah.
And I mean, we've kind of talked about it a bit, like having a professional interpret. Wow, I can't say the word anymore.
It's a tough word. I'm not gonna lie. I mess it up too.
It's like when you start saying a word
Yeah, you
multiple
say like
times, it
really
starts
fast.
messing up
Sometimes
with
it's
it.
like
Interpreter. Okay, got it.
interpreter. Yeah.
Yeah, when you have a professional interpreter, that's obviously a great fix for these situations. Um, on a completely separate note, I wonder how many languages you need to know to be considered a professional interpreter, because it surely has to be more than just two. But uh,
I don't know.
assuming you don't, I don't think like um translator apps or like I don't know if Google Translate or translator apps, would you consider that like a potential fix, something that's better than having like a family member? Or
Some doctors we talk to at school, they do say they use translator apps, especially if it's like a phone call thing. Like there's going to be a translator app that kind of does it for you. Like they integrate it into the phone call based on the telemedicine software you're using. Some doctors even use like some people just have to use Google Translate. Like some places just don't have like a better software, so they do use that one as well. I'm not sure if there's like a healthcare related one. I'm sure there's one out there that's kind of standardized for clinics, and especially in rural areas too, right? Like where you're going to have diverse communities, people with different languages, and you don't have staff. I'm sure technology is being integrated in that way, but the having the presence of a person as an interpreter is a completely different thing, right? Because yeah, that having someone present gives that person comfort, even if like they have the job of translating. It's just like familiarity, right? Like that, oh yeah, this person knows my language, this person kind of knows where I'm coming from. Whereas like from an app or like using a software, even the patient themselves knows that this is just trying to tell me something, it's not really human. So there's that humanized aspect too that is not very present in technology.
Yeah, for sure. I think that's a good point, because anytime you like, language is such an important thing. It allows you to feel so much more comfort with the person that
Yeah,
you're with, right? So if you feel that there is a language barrier, all of a sudden there's quite literally there's a level of awkwardness or a level of discomfort, and in a doctor-patient setting, that's like one of the times where you're most vulnerable, because I don't know,
Yeah.
it could be something very sensitive. It could be a huge case to you, like for a lot of reasons. But it's a very vulnerable and relationship that needs to be. I mean, I think even when like just generally people are traveling to different areas of the world and they don't speak the language of the place you're in, you're kind of hesitant to almost ask someone always for help, because if they don't speak English and you don't speak, I don't know, French, Spanish, Italian, whatever, it's like it's hard, and you're trying to make it work, but you also don't want to bother them too much. So that's it's not exactly the same, but that's not a type of like internal dilemma that a patient should have to go through when they're being treated.
Yeah, I agree.
Right, so I think we should move on to the next scenario.
Yeah, I think we talk a decent amount. It was a pretty straightforward scenario, but there's nuances behind it. That's why we like to dig deep into them. But yeah, let's move on to scenario 2. It is called Dr. Google. It's midnight. Your child's been coughing all week. You open your laptop. One search leads to another. Cough, fever, rash. You scroll through medical forums, images, and a few alarming Reddit threads. Could it be meningitis? Oh my god, what if it's that? By the time you book a doctor's appointment, you already have a diagnosis in mind, and a list of treatments you're convinced they'll miss. It's likely just a viral infection. Let's monitor it for a few days. You nod, but you're not convinced. You've read too much. You've seen too many horror stories online. As you leave, you feel frustrated, maybe even dismissed. Okay, I think that's the scenario. Ali, thoughts?
I think this one's real. Like, this happens, I think, so much every day. Obviously, neither of us are parents, so we can't say firsthand. But I've like known older cousins or family members of mine who are parents or newly parents, and every single symptom they go into the internet and do a deep dive on all the possibilities it could be. And this was where, like, growing up, because I had in Pakistan growing up, my parents were physicians, so that would be like, okay, the phone call come to my mom, they're like, okay, my child is going with this. Could it be meningitis? Could it be this? Could it be that? Like, and they just is all unraveling. It's all like panicky outwards, and it makes sense, right? A lot of times I feel like this happens more with people's first child than it does with their like second or they have experience at that point. They have experience. But the first one is like, I don't know if I've got the saying right, but I've heard the first child is like more learning curve for the parents than it is for the child, if that makes sense.
It makes sense.
The parents are so panicky about it that like Dr. Google or Googling every symptom becomes everyone's first opinion. It becomes their first thing that they trust. What do you think?
I completely agree. Just for context for those who are listening, like meningitis is basically like inflammation in the brain. And it's actually connected to maybe a viral or bacterial infection. So that is probably why this parent kind of found their way to that diagnosis. Especially if you search up like symptoms like on Google. You guys can try it at home as well. Like, just go on Google, open a tab, put in just a couple symptoms that are synonymous with other like diseases. And oftentimes, like, because we have Google Gemini, it's like the AI portion, right? It will give a portion where it's just like, oh, here are some examples of what these could lead to. And if like the first one is meningitis and she just saw that, it's like, okay, my child has meningitis. Like, I can see how they could jump to conclusions, and it's completely normal. But to technology has its, I think everyone agrees, it has its benefits and it has its drawbacks. The benefits is that you can advocate for yourself, you can diagnose certain things, and you can kind of also prepare for the conversation that you'll have with your doctor. I think that's the biggest plus. You come in thinking that you have some information, you're not like completely just reliant on your physician. And it also gives you a sense of empowerment that, yeah, like I know what's going on with my child, I don't have to always rely on someone. But it can also lead to something really dangerous, such as this scenario where you become so fixated on a diagnosis without having like the actual like physical exam, or if you have to do blood work, or like the stuff that the doctor has to do.
Yeah.
So you come into this situation, and for the doctor, it might just be like a 5-10 second thing that, yeah, I know what this child has based on these symptoms and all this, and maybe we'll do blood work just to make sure. But for the parent, it's like, I've done all this research, I've like looked into all of this, and why is this not being brought up in the conversation? So then I see where the parent's coming from completely. But I think it's also a role to play. Again, these scenarios are really, really short, and we try to keep it within podcast format, but I assume that at some point the doctor would try to have a conversation with the mother or the parent, and just be like, hey, is there anything on your mind? What do you think it may be as well? That's one of the things we do in patient history. We ask the patient, what do you think it might be? And that kind of opens the door for us to clear any doubts. She could have just said easily, yeah, it's I think it's meningitis for XYZ reasons, and then we'll explore that further in the conversation. So in order to mitigate stuff like this, we need to give the parent a chance to speak up about what's on their mind. But if that's not happening, the doctor has to take initiative and has to explore it further. Don't just send the patient out just because you think that you're spot on your diagnosis and there's no more room for conversation. So yeah, complicated scenarios. Dr. Google is fun to have, but don't like rely on it completely.
Yeah, 100%. Like, I think the best thing about Google is that it gives you the opportunity to gain a bunch of knowledge and a bunch of information. But the worst thing that you can do with knowledge is use it incorrectly, right?
Yeah.
It's kind of sounds rude or mean to say, but at the end of the day, no, like a parent working and stressed about their child, obviously they're coming from a place of love, but they're not trained in medicine. No. So they don't know the signs and symptoms. A lot of different conditions, have the same symptoms. So when you're just looking at symptoms, it could be a multitude of things. And obviously, being a new parent, being concerned, your brain always goes to what's the worst potential
outcome. Yeah.
And I think that's where it's great, where you have the ability to go to doctors, and when you get checked out, like you said, they should ask, what does the parent think it is, and then try to convince them that, okay, look, I understand that these are the symptoms, but based on so and so and so, it's not that serious. It's just a normal viral infection. It's not that bad. But come out of a place where physicians aren't arrogant on their own diagnosis, because there is a small minuscule chance that the parent could be right. The doctor could make a misdiagnosis and the parent actually could get something right. I think they're obviously, off the top of my head, I don't know, but if you search, you could probably find cases where parents went to physicians with an issue for their child. The physicians looked at a bunch of things and couldn't find a major issue, gave them some prescription, some treatment, which worked for a little bit, didn't stick, and eventually after going to a bunch of different people, they found out it was some rare condition or something like that. I know it's a very specific scenario, but these things do happen. So it is good to be informed, but it's important to also listen to professionals. And that is where I think the balance comes between a parent sharing their concerns with a physician and getting the physician's opinion based off of their medical expertise and the test they're doing, versus a parent who is also overly sure of what Google has told them and just doesn't believe what the physician is saying. Because I think that can also become an issue, no? I don't know if you guys have been taught or learned anything about that type of scenario as well.
Yeah, no, you're spot on everything you said. And before we jump into the next scenario, I'll end it with that point as well. Like the mistrust part is super important to consider.
Yeah,
And even if like the parent is wrong and the doctor is right, you don't want to send the parent back thinking that they're wrong about everything. Like you might put in their mind that their mentality that okay, I was wrong about my child. I'm a terrible mother. I'm a terrible father, or something like that. That can continue to be something that is built at home, but you could easily mitigate it in the office before you send them out. So if you find out that a parent or a patient has gained misinformation, don't like hammer them down and say that you made a mistake, but rather take the opportunity before they leave to just kind of, it's called like motivational interviewing. I think that's a component of it that we learned, where it's a strengths based approach. You go based off the strengths that patient or that parent presented. So like, yeah, sure, they got misinformation, but at the end of the day, their intentions were good. They were caring for their child. So use that as a way to be like, you know what, it's okay, you made a mistake, and you should be proud as a parent that you're so invested in your child's health. Here is just, now you begin the education part. You educate
yeah,
them on what are some credible resources, how you could kind of prevent this in the future. And if you're just not sure, just come back to us, give us a call, we can do a follow-up and
yeah.
do that. So something as simple as that. So now you're making sure that the patient doesn't have any doubts about themselves and their abilities, and at the same time you're redirecting them to something that is more legit for for them and their family.
Yeah.
But yeah, that's it. uh, yeah, I think we can move on to scenario 3 now, our last scenario.
Yeah. All right. So let's start scenario 3: life after rehab. You're walking home from your first week out of a rehabilitation program. The counselors were supportive. The structure helped. But now it's quiet. Too quiet. Your old friends have moved on. Work feels impossible to return to. The doctor said, just keep doing what you learn, but you're not sure how. The follow-up appointment isn't for 2 months. I thought finishing rehab meant I was better. Why does this feel harder now? All right, that's the end of that scenario. Omar, you want to start us off?
Yeah, for sure. Just to clarify for those listening, I know these scenarios seem like super extreme sometimes. The point is to really just sometimes show that these things do happen. And I know for after rehab, there's a lot of support, but there are those cases where patients like this just come out of rehab and they feel more lost than they were when they entered. And yeah, the biggest thing here is that isolation feeling, that you're left alone, and you feel like everything you've done has led you back full circle to a point where you're just like you're in the same position as you were before. And there's always like a component of post of rehab that you have to consider, which is integrating them back into society, considering all the things that will kind of, on a structural point of view, but also on like a personal level, how can they maintain what we've taught them, how can they maintain this growth and this change. So when you don't do that, and you kind of also negate their own feelings, like what's it called, just keep doing what you're doing, or keep doing what you learned, is what the doctor said in this scenario. And the follow-up appointment is in for 2 months, so now in 2 months you're gonna be asked to keep doing what you're doing. Like this is advice that like maybe even a parent can give a child, right? Just keep at it. Like so
like, what though?
Yeah, keep at what though, like you know what I mean. So there has to be like some proper advice, guidance, resources. Send in more follow-ups. You see that the progression's not going well, bring them back in for more visits, and just see why that progression is not sustaining on its own. That's kind of my 2 cents on this.
100%. I think you're right, where like reintegration into your life or your daily life out of that situation is tough. And you're also right in saying that there is some type of support. Like I'm gonna preface this before I continue. I'm basing this off of like a limited knowledge I have of rehabilitation, of like alcohol use, or drug use in North America. I don't have a great knowledge about rehab process around the world, but people have like sponsors that try to help them stay on track.
Mm-hmm.
But sponsors are also just other regular people in the program who have gone through that process themselves.
Mm-hmm.
And they try to connect with you, but it's not a constant thing, right? They're not going to
Mm-hmm.
connect with you the first day you come out, or even maybe the first week. They might do one. Usually,
Yeah.
I'm pretty sure they like do like one meeting a month, or every couple of weeks. That's still a decent gap if you're coming back into society. And aside from rehabilitation of alcohol, drug use, or even pain from the sense of like a medical procedure, we've seen, I think a lot of times there's probably a statistic on this online where people who come out of long stays in like juvenile detention or prison or something like that, which are technically also kind of supposed to be rehabilitation centers.
Yeah.
Like, you're supposed to, for example, if you commit a crime, you go to prison, it's supposed to be like, yes, it's a sentence for rehabilitation. You kind of think of what you've done, reflect, and then you come out. But people's lives change so much that once they come out of prison, there are situations where they don't know what to do. And more importantly, they want to go back in because that feels more like home or like more normal than society does. And they can't function in society anymore.
Yeah.
Which, if anything, that's a whole separate issue on like prison systems and why they don't work properly, at least in like, the US and North America type, or like a lot of other countries. I feel like some Scandinavian prisons are actually kind of nice based on some of the pictures I've seen.
I know. I've seen the
they look
pictures,
like hotels. Right? I swear my dorm room was worse than that. But honestly, it's a case where you need like your life in rehabilitation becomes more normal to you than what was out of it, so you really don't know how to transition, and it makes that so easy to try to end up right back into where you were. And then the biggest thing is, I think, employment help, whether it's being for alcoholic reasons or drug use or rehabilitation for that matter, or someone coming out of prison who has been convicted of felony or some crime, getting a job is almost impossible, which is, I mean, I'd say that's an issue of society or a system, because what you're basically saying is, here you've committed a crime, yes, you've done your time for it, you've actually done what you're supposed to do. All right, you're coming out. Some people even come out early for good behavior. So then, let's say you've actually come out for good behavior, trying to change your life, but now you physically cannot because you can't get a job. And it could be for regardless of what the crime was. Like, it could, even if you were like framed or something. But it varies. There's a bunch of different types of felonies. Felon? Yeah. Sorry.
Felonies. Yeah.
That's twice today. That I've messed up a word. But it's like, how do you start your life? I don't know if you have a thought on like the employment issues of that and how that affects like mental health issues as well.
Oh yeah, I mean, like, it doesn't matter like where you're coming out of rehab. I think like the thing to recognize first is that before anyone goes to rehab, you can't assume that everyone came from the same baseline. Like, we have wage gaps, we have social like determinants of health and all these things. Like, everyone's life is at a different, like, people are from different classes, first of all, right? And different communities, they even have different classes within themselves. So when you send someone out, you can't expect that they will have something ready for them. Like, what if their life was already broken before they came in, right? So then you have to recognize that them going outside, you're putting them back in the same position. Obviously, you cannot completely turn around a person's life, but the best you can do is connect them or help them find their way back, even if it's not respective to like the rehab part itself. Like, if it was like a criminal offense, or if you were going to rehab after like surgery or anything, that's one component. But like, what their life was outside of that, when they were normal, healthy, or like everything was good, that is something, that's a different part of the story that may still remain broken regardless of how well that rehab was. So I think rehab is such an amazing field and part of like healthcare, because you're not just, helping them process what trauma they've been through or whatever they've gone through, but you're also like kind of gluing pieces back together that were already broken to begin with, and they will never have been seen unless they came to you in rehab. You would have
Yeah.
never known that that part of that person's life was actually detrimental, that was going to lead them to a place that was worse. So employment is one thing, stigma is another thing. There's like so many things that are just hidden under the covers.
Yeah.
And that's why, I think in general a person should always never just take a person's concern and just see it as face value. Always try to dig deep, and if you have that opportunity, uncover some of the roots to their problems, because they could expose other problems in their community, in their lives, with their families, that maybe you can't fix their healthcare problem, but you could fix those other things too. That's what's part of being human. So I think that's a great thing.
Before we end, I just want to give one more thing. Is like, aside from also like everything that goes on coming out of rehab, I feel like there's also the case of there's times that people take active steps so that they don't get to a point where they even have to go into rehab. Let me explain exactly. So I have a friend who it was like 2 years ago, he had an ACL injury, so he had to get surgery on his knee, and he actively, obviously for those type of surgeries, when you come out, the pain that you're in is excruciating, and so most likely you are prescribed a variety of painkillers. Some of that can be very addictive, and people can, if you know yourself properly, that maybe you're the type of person who can be more addicted to substances or less or something like that. He actively stopped his or reduced the amount of painkillers he was taking, just because he was afraid that he would get addicted to it. And I think that, while it's a separate concern, the point I'm trying to make with it is that your rehabilitation systems should be good enough so that people don't feel like they have to make that decision, if that makes sense, right? Someone shouldn't feel like, okay, I know that this is addictive, so I have to stop. That's something for if that's alcohol, or if it's recreational drug use, that is a good decision to make. If it's a painkiller and you're afraid that, if I get addicted to this, then there's no system that will help me, actually get back to my normal life. Then that's an issue. It's kind of a niche problem. It's a very specific situation. But my point is basically that with what more or less we've talked about, yes, rehabilitation, I think in the world in general, more so in North America, based on what I've seen, needs to be worked on. Definitely mental health aspect of it, the employment aspect of it, the stigma that comes out of it, because I think stigma is actually the biggest part, because if you fix that, that might fixes the employment aspect of it probably too.
They're connected.
We're basically saying, here's you've put yourself maybe in a bad position, or you've been unfortunate to be in this position. Fix your life by doing these steps. You do the steps, you fix your life, you come back out, and people are like, well, look at the mistakes you made. We're like, but look at the work I just put in.
Look at the work I just did.
The work I just put in to fix it.
It's a stain on a person's image that is so hard to remove.
No, it really is. So I think we're now reaching the end of our podcast. So just to kind of bring it all to a close, today we've looked at 3 quiet challenges that patients face, translation gaps, online maybe overconfidence or misinformation, and the struggle of starting over after rehab.
Absolutely. And they really show how care doesn't just happen in hospitals or in clinics. It's in the conversations, the resources, and the follow-ups that shape that real recovery.
And if any of these stories resonated with you, or if you have lived something similar, we'd love to hear your perspective, your story, or anything else that you feel like sharing to our podcast.
Absolutely. So guys, thanks for listening to the Rare Tapes right here on the Ash podcast. Don't forget to share, follow, and stay tuned for our next story driven dive into the human side of healthcare.